long does it take for the Mommy Makeover, procedure-wise?
How long does it take? Yeah, so the working time for this, a tummy tuck takes about 2 hours, maybe 2.5 hours to do liposuction at the same time. And then the breast part is a little adjusted. If it's a breast augmentation, so just the implants, that part takes an extra hour. And if we're doing a lift, we'll add an extra hour to that. So we're looking at possibly, if it's everything, a lift, implants, tummy tuck, liposuction, probably closer to the 4-hour mark. But if we're doing other adjustments of that, it could be less than that. Like a tummy tuck itself, just 2.5 hours. Yeah.
So as a single mom and one who works, how long would recovery take, and what should I expect with my children?
So the most important thing is to make sure you kind of plan your life around when you can recover. So this is not the thing that you'd want to do right before like a big trip or a major event that is in your life. I won't sugarcoat it. The tummy tuck hurts, right? That muscle repair we talked about to bring everything together does create that deep soreness that feels like you've done 1,000 crunches. And for that, I recommend that people take a week off, like plan on just recovering at home. And usually by day 5 after the surgery, you'll start to add more stuff to your plate. You'll have more activities that you want to do, whether it's cooking food, reaching for cabinets, other stuff in your life, going for walks around the block. And as you start adding more stuff to your plate and it feels comfortable, then that's great. That's your sign that it's okay to do, and you should keep adding more things. But I wouldn't do it right before like any kind of major event. It's helpful to have people at home that can help you, so there's other family members that can come and help you, like how old are your children?
11 and 9.
Okay, well the nice thing is they don't need to be lifted or anything, right. So that's a great time to do it, right? If you have a 2-year-old that needs to be lifted, is gonna cry, it might be good to have someone help you with that sort of thing. But we're realists, like we know that you have to be a mom, right? So if your kid comes crying to you and you have to lift them, we'll give you like advice about like ways to kind of bear hug your child and do it like that. But I'd say, like if you work, you have an office job or remote, plan on at least a week off. And then that second week is sort of up to you. Some people bounce back pretty quick and they want to start a remote job, or they want to, get back in sooner. Because we don't have any drains, there's not going to be any telltale sign. Like no one in your office is going to know that you had cosmetic surgery. There's going to be no giveaway. So you can kind of have your privacy, which is nice. But that second week is up to you. Some people go back to work, some people want to take a little bit more time at home.
And is there a garment that you have to wear, and how long do you wear the garment for?
And we'll give you the garments, yeah. So for like the tummy tuck, for instance, we'll give you like a Velcro kind of compression garment, and you'll wear some version of that for 6 weeks to reduce the swelling. Some people like it. Some people end up wearing it longer because they enjoy that like gentle hug, that the shape support. Yeah, they like the shapewear that gives them that support. And then for the bra, it's just a soft, non-underwire bra. And you can wear any version of that if you have a different one that you like for 6 weeks. And after the 6-week mark, if you want to go back to wearing an underwire, that's totally fine. If you want to go braless, that's okay too, but no underwire for 6 weeks.
How long until the swelling goes down, do you think?
So you'll see immediate benefits, which is nice, like the skin removal, the breast perkiness, you'll see that immediately, right? But then yes, for the next couple of days, the swelling goes up, and that's when you'll be a little bit sore. You may need some help around the house.
Trying to adjust to the whole procedure.
What would you say?
Our bodies are trying to adjust to what happened.
You're totally right. And exactly, like your body doesn't know you had cosmetic surgery, right? Your body, which has been a beautiful human body that's evolved over millions of years to survive like saber-tooth tiger attacks and all the stuff that happens to humans, right?
It's process. So if you're happy about doing this, your body will heal quicker.
You're right. You're totally right. Your mental positivity, your mindset's very important. But your body's going to draw on water molecules and create more swelling in an effort to heal faster. So that's going to be able to make you a little bit bloated for a few days. But then by day 3, that swelling starts going down. And we say in terms of the swelling and the pain, by day 3, every day after that should be less and less swelling. And the nice thing is if you take photos or look in the mirror every day, you should see like a nice improvement. And by the 6-week mark, by the time the garments come off and you're like free to do it, that's when you'll see like a large amount of your results. Things continue to settle and get better and better up until the 9-month mark, but most of that is front-loaded. You'll get so much benefit in the first month and a little bit more benefit at month 8, but you'll see your results like sooner, which is nice. Like I like gardening, so gardening's cool, but you have to plant everything and it takes months to finally get the results and get the fruits and vegetables. But the nice thing about this kind of surgery is after the first month, you'll already be seeing some nice results. So they're more front-loaded.
And any like advice to keep the results longer, or how long the results going to last?
So if you don't get pregnant again, they can last a lifetime, which is wonderful, right? So that's really, really nice, yeah. Because it's the baby that causes some of these hormonal and like skin stretching changes, so they can like last a lifetime, which is wonderful. Once we do that muscle repair, we expect that muscle repair to last a lifetime, which is helpful. You'll get that core strength permanently. And you know, in terms of the recovery, we sometimes recommend you get like a massage of the areas. The nice thing is if you get surgery here, we have the massage therapist here. We include that. You can get a massage as part of the post-operative recovery, which is really helpful.
Nice.
Yeah, so it's part of, we have the best team here. We have nurses, we have, you know, PAs, we have doctors, we have all of our staff is oriented around this, and so we provide sort of a one-stop, you know, full service package here. It's one of the reasons I operate at a few other locations, but this is my favorite place to operate for the facilities and the people that we have. So that's a nice benefit to do it. And then long term, yeah, you want to keep being healthy. You don't want to start smoking if that's something, you know, you weren't doing before. You don't want to have like major weight changes that can affect the results. So, you know, a lot of times people see that this unlocks a lot of the health for them because now they feel more comfortable walking around, or with their core strength, they get back in the gym, they can do sit-ups more easily. So a lot of times this actually unlocks people's, you know, future health, and they get to have decades of the positive results from it. The logistics, sometimes we ask about this. This surgery is under general anesthesia. It's very safe. We have a board-certified anesthesiologist with us the whole time. You'll recover in this facility here, and you'll go home whenever you're ready. We don't chase you out like a hospital or like a hotel. So you spend as much time eating some saltines, drinking some juice, and then we'll have you leave with your loved one in a car. The nurses will give you a call that day. I'll give you a call that night, make sure you're doing okay. And we're always here in case you need us. You have our number 24 hours a day. We'll see you for your first post-op appointment about a week later to make sure things are healing well. Yeah. If you're smoking, you can't have the surgery. I'm very sorry. You can't have any nicotine or tobacco like in your system, whether it's a vape, cigarettes, e-cigarettes, nicotine patch. So if you are smoking, we recommend that 6 weeks before and 6 weeks after you stop. And it's because nicotine deprives your skin of some precious oxygen to heal, and it makes it a harder recovery process. So for your interest, we recommend no nicotine. If you're breastfeeding, we recommend that it take at least 9 months from the last day of breastfeeding before doing any kind of breast surgery. Tummy surgery you can have, but because there's still breast milk in the breast for about 9 months, we don't want to do surgery at the time that there's breast milk. And your breast may continue to have changes. So if you had surgery 3 months after you finished breastfeeding, there may have already been a shrinking of the breast that we were expecting anyway over the next few months. So it's better to just have the breast reach its final size, and then we can come up with a procedure that works for you. So those are some of the other things. And then if you have any other medical problems, totally fine, we're going to talk about it, but we'd still have you go to your primary care doctor, or you can come to our primary care doctors down the hall to get what we call medical clearance. That means some blood work, they'll examine you, make sure your heart and lungs are working perfectly. Exactly, yeah. So we're not a hospital, but we have all the hospital level equipment, but that still requires through our accreditation that we only operate on people that are relatively healthy. So if there's any medical conditions, we have to make sure those are optimized before we do what is the very optional practice of cosmetic surgery. So we live in this wonderful world in cosmetic surgery where we can really help people, but we're not dealing with things like heart attacks and colon cancer and some of the real medical things. So we have the opportunity to stack the deck in our favor, and if it's worth waiting 2 months to get some part of your health up to speed.
It's a guideline, and if you're at risk, you don't want it.
I totally agree with you. Yeah, exactly.
When's the best time of the year to do it?
Best time of the year is when it's working for you, right? When you've got your family kind of situation and everything. Some people like the idea of being in shorter dresses and bikinis or different things in the summer, so they'd like to have that recovery time while we're all wearing like heavy jackets in the winter time to do it. Very popular. But if with your family and work and everything, you'd rather do it in the summertime, we're available. But surgery, the most popular surgery months we have are between December and February.
Okay.
Yeah.
So
Good question.
Yeah, I have a question, because like you mentioned, we do liposuction for tummy tuck surgery. So I have a question, people always ask, oh, when you do liposuction, you take out the fat. Is the fat going to come back?
Good question. Yeah, so liposuction, I can confidently, without a doubt, tell you is a permanent fat removal. When you were a kid or going through puberty, you grew more fat cells everywhere in your body as you're getting bigger, but you don't get any more or less. Through liposuction, we permanently remove those fat cells. They don't double in size, they don't come back the way a lot of the other cells in your body do. So you'll have a permanent reduction in the number of fat cells, which is excellent, and that can lead you to having long-term, lifelong results. If you gain 200 pounds, you gain 200 pounds. The fat's going to go somewhere. But without a doubt, it's not because you're going to get any more fat cells in the area. So the areas that we treat are permanently reduced. And the other myth about liposuction that people have is if we liposuct one area, like we do liposuction of your arms, that your thighs will get bigger. It's not true. Your body doesn't try to correct for the overall amount of fat. So whatever we do, we permanently take out. And after the surgery, I'm happy to show you a picture of the tube we use and all the fat that came out. Usually people enjoy seeing, oh my gosh, you like got half a gallon of fat out of us. You know, like that's a sign of healing. People enjoy, you know, seeing that. So it is a permanent fat removal. Yeah. Excellent.
So after the surgery, like mommy makeovers, and what will be the recovery time, like in the PACU room?
So you'll plan on spending at least an hour with us in the recovery room. The nice thing when you get the procedure done here at our facility is you'll have one nurse with you the whole time. Someone like Sophia will be with you the whole time, just recovering you. They'll measure your heart rate, your blood pressure, keep you comfortable. Exactly right. Yeah, so we've got amazing nurses here. They're trained to do this. And when you operate in a cosmetic surgery center like we do, fully accredited, you actually need the best staff because it's not like a hospital where there's 10 other people you can ask for help and all that stuff, right? So because we're accredited with this highest safety standard, we have to have the people that are the highest level of training to be able to do this.
You all work together and you know each other, so you know where everybody knows where they got to be on the board.
Totally correct. And it's never anyone's like first day, right? So everyone has been doing this, they're experts at this, and this is what they do. I mean, tons of people that work in hospitals would rather have a job like this, right? But the stakes are higher. And so because of that, in an accredited center like us, we actually enjoy top talent for everyone. Doctors, nurses, anesthesia, like all that kind of stuff. So it's a nice place to be. So at least an hour, but we're not, you know, chase you out. Yeah. Usually people recover pretty quick, yeah. And then, you know, we put in long-acting numbing medicine to make it so you're not going to wake up in a lot of pain, which is great. And then over the next few days, we'll keep you comfortable. Make sure you have adequate access to us. You'll have medicines to reduce the pain. But by day 3, things start getting better and better, which is nice.